The National Institute for Communicable Diseases confirmed that a suspected case of COVID-19 has tested positive.
The National Coronavirus Command Council has decided to enforce a nationwide lockdown.
The objective of why they're saying they're banning alcohol is because of the coronavirus. And I'm saying that that's not a scientific, it's not based on science.
There is not even anyone who's coming to control the situation or anything that's going on in here.
We're not even united, my brother.
Others, they are sick, others, they have a low stroke.
A new viral outbreak from China is spreading around the world. Countries like the US, Japan and Thailand have confirmed cases.
Today, the CDC and the Illinois Department of Public Health announced a second case of novel coronavirus in the United States.
A Chinese health official has said the virus is adapting and mutating. So far, hundreds of cases have been confirmed and several people have died.
The president has issued the instruction for the evacuation of South Africans from Wuhan in Hubei province in China.
WHO has been assessing this outbreak around the clock, and we're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction. We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
When the World Health Organization made that declaration, South Africa had just confirmed its first case.
The National Institute for Communicable Diseases confirmed that a suspected case of COVID-19 has tested positive. The patient is a 38-year-old male who traveled to Italy.
A wave of apprehension for South Africans. It would not be long before the country would see a great snowballing of infections.
Another 4 members of a tour group that visited Italy test positive for the coronavirus in South Africa.
A Limpopo doctor tests positive for the coronavirus.
The number of confirmed coronavirus cases in South Africa has now risen to 274.
By the 23rd of March that year, the cases recorded were over 400, a 128 increase compared to the previous day. This forced the government to impose a nationwide hard lockdown.
As a consequence, the National Coronavirus Command Council has decided to enforce a nationwide lockdown for 21 days with effect from midnight on Thursday, the 26th of March.
Even though other governments around the world had taken the same measures to curb the spread of the virus, in South Africa, panic and anxiety heightened.
If you for 21 days labor ikhuluma yena then ngizoba ngaspan for 21 days angazi ukuthi kuzoyenzakalani.
There's no correlation between COVID-19 and alcohol. There isn't. There are social ills, that's true, to do with alcohol. But the objective of why they're saying they're banning alcohol is because of the coronavirus. And I'm saying that that's not a scientific, it's not based on science. And I'm saying, where have the police been all along? Where have the traffic police been to curb drunk driving?
However, a few days into the lockdown, the country would soon be quiet as some citizens were forced to comply. And wildlife finally reclaimed the streets. However, both beautiful and unusual, This was the quiet before the storm.
They keep on bringing a group of more people each and every day. So we cannot be having a social distancing here.
Others, they are sick, others, they have a low stroke.
Isisu asikolodo ngilambe ngoku mina ndingumuntu okwazi mhlawumbe ndiqhubele itroli yami ndihambe ngesikala kubhalwe kwaScrap kubhalwe kwantoni yonke ngoku ananemali ngoku ndiyaphuye undinika i-20 rand ndikhola ngoku unganika
usemsebenzini baba
usemsebenzini qashiwe shem wena mna mntu ungaqashwanga ndithini.
As lockdowns became stricter, some tried to smuggle their loved ones from province to province, even with the interprovincial travel bans being placed.
When of human trafficking, we must arrest you.
And some restrictions proved harder to bear.
Baba Nkosi, sikhulukelela amanzi Jesu. Asazi wena wathini ukuze amanzi ashintshe beyiwayi. Ngomile Nkosi, ngicela amanzi ashintshe beyihene again.
My fellow South Africans,
some wounds remained deeper as the virus continued to wreak havoc. Finally, 2 years later, after different levels of lockdowns, the president declared the end of the national state of disaster.
while the pandemic is not over, and while the virus remains amongst us, these conditions no longer require that we remain in a national state of disaster.
But while many may want to forget the horrors brought by the pandemic, others continue to suffer its physical, emotional, and financial consequences.
I think the government handled this whole thing very wrong. That's my own view.
Sibusiso, a father of 3, narrates the emotional turmoil he goes through on a daily basis since losing his employment.
Everything just changed when time goes on. Now, you have to get another job. You can't provide for bona. It's gonna be tough. So they decided, we're gonna move out. I do blame the government. I think they should have tried against show with umuntu oluze umsebenzi if kunamanye amakhampani afuna abantu baqale ngabo at those times.
Blaming anyone wouldn't actually bring me any peace.
23-year-old Katleho lost his grandmother to COVID. She was a sole breadwinner at home. Now left to fend for himself, he lives off handouts.
I get very emotional. I actually don't know. It's like I could actually burst, you know, because she was there. She was actually, I could say she was my rock, my father, my mother. She was everything. Abantu besonto bangisiza kakhulu. Namanje basangisiza. I understand. Kunomunye ubaba bathi strike netorch. After Gogo's passing, he actually took me in as his son. That's where I eat. That's where I bath. Other than that, ekhaya nje ngihlala kwenye room encane. Leyo room leyo, there's no stove, there's nothing. You understand?
Some entrepreneurs are still reeling in the aftermath of hard lockdowns.
Lento lesiphila ngayo. Esilokubhanisela imithetho ukuthi no kwenziwe kanje kuhlalwe distance eso. Ningakwenza lokhu mara ibusiness iqhubeka. Bona manje mabavala basho ukuthi sibulawa indlala.
Now that things seem to be getting back to normal, do South Africans have nothing to worry about anymore?
The WHO keeps a view of the global patterns in many other countries as well. So that will also give us an idea if there's any change in the pathology of this particular virus, or the effect of this virus. Is it mainly in older adults that it's more severe, or has it changed to children? So those are the pieces of information that still keep us informed about this particular virus, yes. But the key part is preventing severe infections resulting in you all being hospitalized and dying from your disease. So there's still people that are having severe disease and are still dying. So my view, and I'm sure many experts would agree with us, is that we need to encourage people to vaccinate. In South Africa, we've only vaccinated about just maybe 50% of our population that need to be vaccinated.
Since on that COVID, in a certificate sokuhlaba namanje isandla sami asisipani grade since ngihlabile nge-COVID, so I don't know ukuthi is affect me or what.
Ngahamba ngayo hlaba yona le vaccine yakhona le ukubuya kwami la ngafika ngahlala until 9 o'clock la ngaphakathi. Then the following day I couldn't wake up.
The side effects are minimal. They're about, and they apply to many vaccines, not just this particular vaccine. When we look at the general side effects that we do see when you are injected in the arm, for example, it can be sore, painful. You may have some nausea and vomiting, but these resolve, and you can treat them. You can use Panado, for example, and you can have bed rest, and it will resolve. And there are severe side effects, but these are rare, really rare vaccines. In fact, when I look at recent data from SAPRA, I can't really see that it's a major problem in South Africa.
Just hopefully, man, they'd find us jobs. That's one thing, we need jobs, please, because now we're sitting, we're just hoping for a call from someone to call you, can you come do this for me, then pay you. So at least if you get a job, maintain your kids, I'd be happy.